We're now going to show a few moments of a gem video that was organized by my dear brother Akiva Nussbaum, and we're going to show it now on the screen.
I mean, it was interesting because having spent a lot of time right here on Eastern Parkway as a young child, we never really knew about the Lubavitch or the Lubavitcher Rebbe. You must remember in those years, Eastern Parkway was filled with Jews of various groups, including Crown Heights. So there's no one thing that stood out. My first meeting face-to-face, with the Rebbe was, other than for Bregenz, a more personal contact was in Lamed Ches, when the Rebbe had the heart attack. In those years, I was I was involved heavily with the intensive care unit at Einstein, taking care of the children that went to open heart surgery, and also doing high risk, you might say high risk of consultations on very sick children, and even cooperating with the adult staff also in terms of the sickest of what we felt were the most sick in the area. So when I came to Crown Heights, we came to Crown Heights for the Lamed Ches, that was our first Tishrei in Crown Heights. Having been here for Bregenz, I was familiar with the Rebbe already. We were in the back of the shul in Crown Heights. It was very crowded. It was Shmini Atzeres. And with my children and I were on the bleachers, the old bleachers that used to be in the back of the shul. And all we knew is that the shul was very crowded. And when we got out, we realized that the Rebbe was sick or needed some help and might have had a heart attack or just needed air. I ran back. We were staying with the Metzgers, that's Alter Ben Sion, Rabbi Dr. Alter Ben Sion Metzger and Yehudis Metzger. And in those years, because I was so trained, I spent more time in the intensive care units than I did even at home. I carried all my equipment with me to resuscitate people, anybody, anywhere. I was prepared for anything, which it was just kind of my natural, that's what I did. So I brought with all the resuscitation equipment I needed to resuscitate almost anybody. And I ran back to the Metzgers. I brought the equipment with me. We went back to 770. And at that point, as I got there, the Rebbe was walking into the sukkah with Rabbi Dr. Seligson and his wife. And when he came out of the sukkah, he still didn't look so good, but he went back into his room. When the Rebbe went into the room, there were a few physicians there. There were about at least 10, 12 physicians who were in the shul at the time, there to also everyone wanting to assist the Rebbe in any way possible. Somehow some people recognized me, knew me, and allowed me to be one of those people who got in toward the Rebbe. But we were mostly in what we would call Gan Eden Takton, and we had to stay outside the Rebbe's room. And little by little, some of us were allowed in the room as we realized that the Rebbe just didn't feel well. Was more sick than we really wanted. It wasn't just a routine illness. One by one, the other physicians who were there had left. They figured there was just nothing more they could do for the Rebbe. And the Rebbe just, as I said, just looked sick, but we did not have a specific diagnosis, although we suspected it could be heart, because he was a little bit short of breath. The only ones left, basically, at the end, those of us there were a few of us left. There was Dr. Lev, Dr. Winch, and Dr. Bob Richter, and me. And around midnight, we decided that the few of us who were there were going to split up our shifts because we just needed to be alert. I stayed because I felt that if anything was going to happen for cardiac patients, it frequently happens late at night. Usually, as the circadian rhythms of the body change, there's more of a chance for a cardiac problem to manifest itself. Around 12 o'clock, about midnight, 1 o'clock in the morning, the only ones left at that point were Dr. Richter and myself. And we decided that he would take the first shift and I would go lie down. He would take the first shift watching the cardiac monitor, which we had set up right outside the Rebbe's room in the area we call Gan Eden Taktainam. and I would lie down. I was going to lie down on the floor, right where the sink used to be in that area. So I was about to lie down. As my head got halfway down to the floor, Dr. Richter, who was watching the monitor, banged on a chair, and I never made it. My head never made it to the floor. I got up, and we saw that the cardiac rhythm of the Rebbe changed drastically. It went from an otherwise normal rhythm to a very, very bizarre pattern, which we realized was very, very ominous. I had already prepared the hour before, I already prepared some solutions, intravenous solutions to give the Rebbe to calm the heart down or to assist in the beat, in the rhythm of the heart and the work of the heart. So we went into the Rebbe, he and I, and we explained to we went into his room. Rebbe, we had his bed set up for the Rebbe in his room. We went into the room and explained to the Rebbe that there was a change in the cardiac pattern, and we're going to have to start some medication. Going back, and so we started the medication. After the other doctors had left, I thought I would also try to convince the Rebbe to go to the hospital. I explained to the Rebbe that we had a lot of cardiac equipment here. We had many things we could do to help him, equipment-wise, but it would still be better to have a full staff and to have even more extensive equipment available in an intensive care unit in a hospital. The Rebbe still didn't want to go. It was just the Rebbe and I in the room, just the Rebbe and me in the room at that time. He said, "Do you see this desk?" I said, "Yes." He pointed to his desk, he pointed to his chair. "Do you see my chair? Do you see these books?" And each time I said, "Yes, yes." He said, "This desk and this chair and these books have heard the tears and the energy of my Hasidim, of all my Hasidim, and this is the energy that's going to get me better." So I couldn't argue with that because I knew that there was something going on over and above what, also going back to another hour or two before this episode where the heart attack began to manifest itself on the cardiac monitor, going back around, I guess around 10 o'clock at night or so, the night of Shmini Atzeres, I went into the Rebbe's room to see how the Rebbe was doing. And the Rebbe looked at me, and it was just the Rebbe and me in the room. The Rebbe looked at me and said, "How are things going?" So I thought to myself, he knows more about his cardiac status, his physical status than I probably do. So somehow the idea came into my mind to tell him, I still see the Hasidim dancing and singing. I still see people dancing and singing even in the streets. The Rebbe looked at me and smiled and shook his head yes.
So I guess, Rabbi Kolarski, you're right. He was a doctor, but I think first he was a chassid and totally bottle to the Rebbe from the first moments when he met the Rebbe personally in Lamed Ches.